Let's briefly dip into proceedings in Durban, where Health Minister Dr. Phaahla has just accepted a memorandum.
MEC Nomagugu Smelane for being here. I think chairperson and the leadership of the Civil Society Forum, I think this is indeed in the spirit of cooperative governance, of civil society, government, the whole of government, from the local to the national. So you want to say that with this, it's just a practical and symbolic gesture to say we are in this together. Let me apologize that we're not able to join in the morning. We started, as the chair has indicated, at 9 o'clock. We started at the TB in Durban. Now, on my side, it was even more complicated. I had to leave the MEC there because at 10 o'clock, as comrades will be aware that last week, this time, we were in Parliament, where we were debating the National Health Insurance Bill, which was then passed later that day by the National Assembly. So from there, once the bill has been passed, it was then referred to the National Council of Provinces. So our comrades in the National Council did not waste time. The day after that, they instructed us that we must brief the committee, what is called the Select Committee on Social Services, which includes both education and health, that 10 o'clock. So as soon as I finished speaking at the TB, I had to go get the room across and join the Select Committee of the NCOP to make a presentation on the National Health Insurance Bill, because they want to make sure that they process the bill immediately. So when I'm coming here, fortunately the chair closed the meeting at 5 to 12. So I was able to quickly just run here to come and receive. So I want to appreciate your patience also. All these things, comrades, are in the interest of the matters which are in this memorandum in one way or another. So some of those are immediate, as already indicated by the chair and your leadership here, which we must address together. And I'm happy that you do acknowledge the fact that while there may be weaknesses in terms of actual implementation in some of the areas, but clearly from right at the top of government, from the president, there is very clear indication that there is commitment. There is no lack of commitment. There might be weaknesses as at the level of practical implementation of some of the areas, and we appreciate your the fact that you also acknowledge that. You see, we know that the government has got a lot of weaknesses, but just like any, you take the government as your child. So as a civil society, you are the ones who elect the government, so you are the parents of the government. So like the government is like a child. So when you are a parent, like you as the voters, if you don't, here and there where you see some good things, acknowledge them. You may not have something to give the government because the government must provide services. But if you keep on sometimes saying, yeah, no, I think it's a good encouragement. But also where you see some weaknesses and shortcoming, as you are pointing out here, it's going to be very helpful. So I want to assure you that there is no hesitation in terms of the issues which have been raised, which the chair has read out here, that the government remains committed, and where there are slow performance, we appreciate you being able to remind us of those commitments. So I will immediately, before the closure before we adjourn the AIDS conference on Friday, I will definitely make it a point that I find a way to deliver this also to the Deputy President, so that through his leadership, as our chairperson of the IMC in SANAC, and also through SANAC itself, he can lead us with our support, because as a Department of Health, we are the foot soldiers to make sure that government, together with colleagues, as was already indicated, social development, also in the peace and stability cluster, the justice and police and other colleagues in that cluster, we are all together in making sure that this can be, the shortcomings can be addressed. Some of the issues, of course, also need our colleagues in the economic cluster as well to make sure, because we always say that it's one thing to recognize the rights, but if also women are not empowered to be able to stand on their own through economic empowerment, that is also not going to be good enough. So both women, youth, and people with disability must also be empowered economically and also in terms of income. So all those issues we will be able to follow up. So I'm going to try as early as tomorrow to make sure that I can find the DP and make sure that I deliver to him, and then I'll also make a copy for myself so that I can also be able to make sure that from the team of the department, together with MEC, can attest that on Thursday we will also be meeting as what you call the National Health Council. Most of the MECs are already here, so we're also going to table this at the National Health Council on Thursday when we meet all the MECs of health of all the provinces. So the work starts now. The work starts immediately now. We're going to share the memorandum with all the colleagues and make sure that this can be addressed. So with that, Chairperson and the leadership and the CEO, I didn't acknowledge our CEO, Dr. T. Also under your watch, I'm sure you'll also be helping us, working with DG and all the other leadership of other departments and also across all of government. I'm sure we will be communicating, and we will make sure that there is a proper way in which we can then have a detailed engagement in the presence of the DP, and agree also on time frames in terms of monitoring to see the issues on which then there's a particular performance which you must then be able to monitor in time. So thank you very much, colleagues. We still have a long day. I know that you must be quite tired and hungry because you started quite early in the morning. So I don't want to keep you here for long. Just to say we'll be here for the whole of this week. But we'll be catching up, and we'll make sure that all the issues here reach the right people and they're being addressed accordingly. Amandla! Amandla! Thank you very much.
Right, and that's where we leave it for this hour. We'll come back at the top of the hour with more business news. We'll take a look at your markets, general news and sports as well. Do stay with us.